This training will take a look at how to add someone to the wait list. You will request through the quiz what regional coalitions you cover, even with outreach or housing. So whichever regional coalitions you cover, and that's the one that you will request access to. You can select more than one, okay? All right, so we're going to take a look at how to add someone to the wait list. First, you want to always search for the client to make sure they're not already in the system. You can clone them over and then add them to the wait list. So you can utilize any function that's already available in the system to put them into the outreach program. We're going to just put someone new into the system so you can have a look at how the intake works and how to add them and then how to do the newbie aspirate add. So to do that, I'm going to go to Census, Intake Admission, choose my CES outreach program, whichever regional coalition the client's in. You can put their name here or you can click continue to add them. These are the people that are currently in that program. I want to do create new application. And here's where we're going to enter the information on the client. Sometimes there's going to be times where you do not get all of the information on the client and it's going to be unknown information. If that is the case, it is fine for you to put unknown information. If you are a housing organization, you will have to get it to house the client. But for outreach purposes, if you do not get the information at the beginning, you can put unknown information. Here for intake date is going to be the date that you first engaged them. I'm going to backdate it to the 1st of June. You have the client location, which will always be our continuum of care. A primary worker, you're going to put your name here because you are the one doing the intake into the system. All right, so the client that we're going to put in today is, I'm going to put Taylor Swift into the system. Full name, social. Okay, you have full number here. It's not required. Veteran status, I'm going to say no. And then living situation. All right, so you have homeless situations, institutional, transitional, and permanent, and unknown. Okay. You want to make sure that if you're putting them in outreach, that you're encountering them in an outreach situation. If, for instance, a client comes into your facility or into your agency or wherever you are located, and they are telling you that they are in a place not meant for human habitation or an emergency shelter, you have to actually validate that that is accurate. So you want to make sure that it is true before you put them into the system. So outreach teams that go out into encampments or go and do outreach in emergency shelters should be the first pick of the people that you're putting into these outreach programs. So I'm going to say place not meant. Length of stay. Length of stay is the length of time in this place here. So I'm going to say 90 days or more. Approximate date homelessness started. You want to put it back to when they originally became homeless, the very first time. So I'm going to say in 2017. Number of times a client's been on the streets or an emergency shelter, I'm going to say 3 times. The total number, you're going to calculate all of those 3 times together, and that's where you'll get the 12 months. Okay, income. If you say yes, you have to answer. Covered by health insurance. Special needs. All right, so I'm going to go through here. If I say yes to one, I have to answer the follow-up question, which asks, expected to be of long, continued, and indefinite duration and substantially impairs their ability to live independently. If I say yes, it will automatically put that to yes here. Okay, domestic violence. Okay. Number of children. If you say they have children, you're going to have to answer the age and the gender. Okay? I'm going to say no children. Homelessness cause. You have several answers here. You can only select one. So what is their ultimate reason for becoming homeless? All right? Eviction, illness, domestic violence, drug, alcohol abuse, a mental illness. So you just put here whatever the answer is. County of last permanent address. It says last, but just remember you're wanting to put the current county that they're in and where they would, I would assume, prefer to be housed. So here, because we're using Delta, I'm going to put Washington County. And then at the bottom, you put what they are seeking. And then you process admission. It's going to ask you the consent. So do they agree to share all? Agree to share all with the exception of, or they do not agree to share any information. And then click continue. Okay, this is the read only. You can print it out if you'd like, and then click continue. I'm going to start a household by clicking to insert this date here below into the household start date and clicking continue. Okay, so would you like to add another household member? For the cases of the CES outreach programs, we suggest that you do not add household members here, and if the destination program is going to house the client, they can add them once they put them into their program. So here you just put the number of children, and then here you would say no and click continue. Okay, the phase sheet is where you will go to put all VI SPDATs, any forms that you're going to do, that is where you will do it. Okay, so I'm going to go ahead and click phase sheet, and this is what it will look like. Up at the top, you'll have form/assessments. If I select it, you have multiple forms here. You have rapid resolution form, VI SPDAT 2.0, VI SPDAT family 2.0. So if this person had children under the age of 18 in their household, you would do the family 2.0. If they do not have anyone under the age of 18 in their household, you do the 2.0. If you are helping them resolve their situation and you utilize rapid resolution, then you're going to fill out this form here. Okay, so those are the forms that you have available. Once you've completed the VI SPDAT, the VI SPDAT has to be done first before you add them to the wait list here. Okay, so I'm going to go through the VI SPDAT. I'm going to do it quickly, and then I will add them to the wait list. Okay, so I'm going to scroll down and I'm going to the first section. Here, I'm the interviewer. What's the agency? So I'm going to put mute here, so mute gets the credit for doing this VI SPDAT. You can put time and survey location. Okay, I'm going to say yes, they consent, and no, they are not under the age of 60. Over the age of 60. Okay, next section. Now, remember, these questions are different than the previous VI SPDAT. You want to make sure that you have them and the form. If you are doing it by paper before you put it into the system, you want to make sure you have that available to you. And the questions are a little different. Some of them are combined, some of them are worded differently, and it's less. It's only 27 questions instead of 50. So here, where do you sleep frequently? All right, how long has it been since you've lived in permanent housing? Stable housing. In the last 3 years, how many times? Okay, and then you're just going to go through and you're going to put the number of times for all of these. You want to make sure you're reading the questions to the client and they're able to answer. I'm just going through this and clicking tab and answering the questions. And then I'm going to click save at the bottom and go to the next section. Okay, here on this section you have wellness, and this is the last section. Okay, so have you ever had to leave an apartment, shelter program, or other place you were staying because of your physical health? And I'm just going through because this is a fake person and putting answers in so we can get a score. Okay, once I've done that, you should have a score at the bottom. You have each section's score, and then you have a grand total. The grand total is the score of their VI SPDAT total. All right, so these are the scoring recommendations. It's changed a little bit from the previous VI SPDAT. So you have 0 to 3, no housing intervention, 4 to 7, an assessment for rapid rehousing, and then 8 and above is an assessment for permanent supportive housing. All right, follow-up questions are very important for people that are taking off of the list. So if you are just doing outreach, you need to click update follow-up questions and make sure you're putting information here so the person that's looking for them knows where to go. So on a regular day, so you can say behind I don't actually know if Greenville has a Walmart, but I'm just putting information here. Time of day, 12:30 p.m. Phone number, email, and then if they want to take a picture, save. Okay. All right, so VI Spit Out is complete. All right, so I'm going to go at the very bottom. You can go back to the face sheet. We want to make sure that we're updating the referral source if someone was referred. So I'm going to scroll down to Taylor's information here, and it says referred by. So here I'm just going to click update referral source. And it's just like if you were to put any referral source in the system, you can say self or agency. If I click agency, it will pop out. It'll give me a long list. But I can also search, so I'm just going to say fake agency serving fake clients. And then Barack Obama was the contact person, and I'll click continue. Okay, so now we've added who referred them to us, if anyone did refer them. All right, and now that I've done the VI Spit Out, I can add them to the wait list. Once I select that, I only have one available wait list here for Delta because I put them in Delta Outreach. That's the only one that's available. And then here I can put a note. Okay, say that the client agrees to be added to the list, and then click save. That is how you add someone to the wait list. If you want to edit, you would just go back here and you can edit the information you put in. You can add them to a different wait list if you need to. So these are the different options you can do here to edit. You would go back to the face sheet and back for the specific client to edit. Okay, so that is how you add someone to the wait list.